is Missy Lavender, CEO and founder of Renalis. Missy,
hi.
Great to have you in the StartUp studio. Tell me about Renalis. What are you building?
So we're building digital therapeutics for pelvic health. So think about leaking, bleeding, chronic pain.
Okay.
Those are the kinds of things that we want to nip in the bud by giving a woman, starting with female bodies and moving, we're pelvic agnostic, so we'll take you guys later. But we're building basically a personal pelvic health coach that we're then going to have fantastic outcomes with and then take to the FDA, get it FDA approved, and then get reimbursed for it.
Now we've interviewed nearly 100 entrepreneurs and you're the first to have a laser focus on pelvic health. So how did that become the centerpiece of Renalis?
Grumpy patient.
Grumpy patient?
Yep.
Okay. I kind of figured there was a personal story. There's always a personal story.
Always a personal story. Yeah, it was really distressing to me to see how many things I was experiencing that other women I was encountering were, and seeing their heads nod, and then I would say, well, how do you not know about this kind of provider, this kind of therapy, this kind of device? And they're like, doesn't it just go away? Oh, that's ridiculous. So I've been in the space for 15 years on the nonprofit side, and then Renalis is 3 years old. And we've always been about creating solutions. So we don't want to just educate and advocate. We really want to put the woman in the middle of her care pathway, give her the therapeutic tools that work out there in a one-on-one setting, like with a therapist or a nurse practitioner. There's no reason that can't be on my device now and have my own AI-informed personal pelvic health coach and make a difference.
Okay, so walk me through what that health coach looks like. Is that daily content? Is that a chatbot? What are we talking about?
Yes, so it's a conversational agent.
A little bit of everything.
A little bit of everything. So starts with kind of a smart tool that we've created that basically ramps up the first thing every bladder patient encounters. We're going to start with bladder because out of the $100 billion cost of this area below the belt, 67 billion of it is from the gotta go thing, which is not very fun. And men and women get to experience it, but women 2 times more often. So it responds really well to this kind of therapy. So the right kind of exercises, the right kind of behavior modifications, the right kind of training for your organ down here called your bladder. So it's basically, I'm chatting with my best girlfriend who's a nurse practitioner. Her name is Cece right now. We'll have a different version later for you. But she basically is going to get some data, some validated patient-reported outcome measures, going to have you set some goals, going to start talking to you about you personally and how you're using your body, and then start teaching you some things while she's tracking your adherence, while she's tracking your experience, and that all gets back to your provider in a metadata kind of way. So, you know, if you're starting to fall off the wagon and not doing anything, the practice needs to know. But otherwise, we want to take all of that off of them, unless or until she needs more.
Got it.
That's a primary driver for the tool.
Okay. It sounds like a tool that once you really zero in on one therapy, you're going to be able to expand it. Are there thoughts that there will be phase 2, phase 3, phase 4?
There will be other conditions. So we're working on one right now for fibroids and endometriosis. That's more of an awareness coaching platform, so meant to get to early detection and intervention for fibroids and endometriosis, and targeted to a mom of a puberty age girl. But we're looking at chronic pelvic pain and potentially fecal incontinence right behind there, some really, really prevalent, expensive, uncomfortable conditions. So what? We like all of that. Everybody poops and pees, we want them all.
I appreciate that. I mean, you're going after just things people don't want to talk about. And yet are so uncomfortable, expensive, problematic. I don't know. Is there something about why is it that you've wanted to go after those areas? I don't know.
Because they are such a bummer. I mean, when you leaking, bleeding, or chronic pain, you're not doing anything everybody wants you to do. You're not moving. You're not leaving your house. You're not having relationships with your partners. You're depressed. You're anxious. Then you're hypertensive, obese, diabetic. You know, all the things we really care about in the world. Well, I think it all starts in your pelvis. So that's a problem. And it affects at least a third of all women. That's a low number. And 20% of all men will have something. So it's expensive, it's prevalent, and it's really not fun. And there are things that can actually make a difference that we can deliver. I think we can personally affect everybody's outcome for the positive, but we'll have a trial next year, 2 of them hopefully, that can prove some of these outcomes.
That's awesome. Other things in 2020 that you're particularly excited for?
Yeah, well, I'm part of a couple of big NIH consortiums. We just wrote another SBIR, so hopefully we'll get another NIH grant. We got one last year. So that one, the clinical study, will kick off in the second quarter. We're going for our first FDA meeting second or third quarter, and we're going to finalize our MVP and hopefully raise $1 million along the way.
Fantastic, awesome.
Yeah.
Well, we're going to be looking out for what you're doing in 2020. I love the innovators who are really sort of looking upstream and trying to stem problems further up. And it feels like that's what you're doing. So
definitely. We want to change the world 1 million pelvic floors at a time.
It's awesome. All right. Missy, great to meet you.
Thank
I
you.
hope it's an awesome week for you, and we'll be watching for what you do in 2020.
Appreciate it.